Hip stability and lateral strength become increasingly important after age 50 for balance, fall prevention, and functional mobility. Today we're covering 4 targeted exercises specifically designed for hip stabilization: side-lying hip abduction, posterior hip abduction, standing hip drop and abduction, and standing hip extension with external rotation. These exercises target gluteus medius and deep hip stabilizers often neglected by traditional exercises like squats. When practiced correctly and consistently, they can help improve lateral stability, balance, and confidence in movement. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have recent surgery, hip problems, balance disorders, or other health conditions. Understanding hip stability importance after 50. Hip stability, particularly lateral pelvic control, becomes crucial after 50 for several reasons. The gluteus medius and gluteus minimus muscles stabilize pelvis during single-leg stance, control lateral hip motion during walking, prevent pelvic drop and knee collapse, and support spinal alignment. These hip stabilizers often weaken with age due to prolonged sitting, reduced varied movement, and exercise routines focusing primarily on forward-backward movements. Weak hip stabilizers contribute to lateral instability and increased fall risk, altered walking patterns, lower back pain from poor pelvic control, and knee pain from collapsed alignment. Research shows that hip abductor strength is a strong predictor of balance ability and fall recovery in older adults. While traditional exercises like squats effectively strengthen gluteus maximus, they often underactivate gluteus medius and lateral stabilizers. These 4 exercises specifically target these crucial stabilizing muscles. Exercise 1, Side-lying hip abduction for lateral stability. The first exercise is side-lying hip abduction, strengthening gluteus medius through direct lateral movement. This fundamental exercise builds lateral hip strength essential for walking stability and balance. Here's how to perform side-lying hip abduction safely. Lie on left side on mat or carpet. Extend left arm overhead or bend for head support. Stack hips and shoulders vertically. Bend bottom left leg slightly for stability. Extend top right leg straight, slightly forward of torso. Critical technique: point right toes down toward floor, creating internal hip rotation. Keeping leg straight and toes pointed down, slowly lift right leg laterally 6 to 12 inches. Don't lift too high, focus on controlled range. Pause at top for 1 second. Slowly lower leg with control. That completes 1 repetition. Perform 12 to 15 repetitions with right leg. Roll to other side and repeat 12 to 15 repetitions with left leg. Start with 1 to 2 sets per side. Rest between sets. Progress to 2 to 3 sets as strength improves. Essential form reminders: maintain toe down position throughout, internal rotation activates gluteus medius optimally. Keep hips stacked vertically, don't roll backward. Move slowly and controlled, no bouncing or momentum. Lift to moderate height only, quality over range. Keep torso stable throughout movement. Modifications: for difficulty lying on floor, perform standing version holding support. For limited range, reduce lift height while maintaining proper form. What to realistically expect: with regular practice 3 times per week over 6 to 10 weeks, you may notice improved single-leg balance, enhanced walking stability, reduced pelvic wobble during gait, and stronger lateral hip control. This foundational exercise builds crucial hip stabilizer strength. Exercise 2, Posterior Hip Abduction for rotational control. The second exercise is posterior hip abduction, targeting deeper gluteus medius fibers through external rotation pattern. This variation trains rotational hip stability essential for turning movements and directional changes. Here's how to perform posterior hip abduction safely. Lie on left side in same starting position as previous exercise. This time, position top right leg slightly behind torso instead of forward. Critical technique: rotate right foot upward toward ceiling, creating external hip rotation. Keeping leg in this externally rotated position, slowly lift right leg laterally 6 to 12 inches. Focus on controlled movement from hip rotators. Pause at top for 1 second. Slowly lower with control. That completes 1 repetition. Perform 12 to 15 repetitions with right leg. Switch sides and repeat 12 to 15 repetitions with left leg. Start with 1 to 2 sets per side. Progress to 2 to 3 sets as strength improves. Important form points: maintain external rotation, toes up, throughout movement. Keep leg position slightly behind torso. Move slowly, emphasizing control over range. Keep hips stacked, don't roll forward. Upper body remains stable. Modifications: reduce range if external rotation position is uncomfortable. Hold leg at comfortable angle if full external rotation is difficult. What to realistically expect: with regular practice 3 times per week over 6 to 10 weeks, you may notice improved rotational hip control, enhanced stability during turning movements, reduced lateral sway while walking, and better balance during directional changes. This exercise trains hip stability in rotational patterns often neglected but essential for daily function. Exercise 3. Standing hip drop and abduction for pelvic control. The third exercise is standing hip drop and abduction, training pelvic stability during single leg stance. This functional exercise builds lateral control essential for safe walking and balance. Here's how to perform standing hip drop and abduction safely. Stand near wall, counter, or sturdy chair for balance support. Stand on left leg with slight knee bend. Lift right foot slightly off floor, hovering just forward of body. Turn right toes slightly inward. Slowly swing right leg outward to side 6 to 12 inches. As right leg moves out, allow left hip to drop slightly. Using gluteus medius on standing left side, pull left hip back up level. This creates work on both sides, moving leg and stabilizing leg. Return right leg to starting hovering position. That completes 1 repetition. Perform 10 to 12 repetitions on left leg. Switch legs and repeat 10 to 12 repetitions standing on right leg. Start with 1 to 2 sets per leg. Rest between sets. Progress to 2 to 3 sets as strength and balance improve. Critical technique reminders: use nearby support for balance as needed throughout. Move slowly with control, no rushing. Focus on using glute on standing leg to stabilize pelvis. Keep torso relatively upright and stable. Small controlled movements are more effective than large swings. Modifications: hold support continuously with both hands if needed for balance. Reduce range of leg swing if balance is challenging. For progression, use lighter support or practice near wall without touching. What to realistically expect: with regular practice 3 times per week over 8 to 12 weeks, you may notice improved single-leg standing stability, enhanced pelvic control during walking, better proprioception and body awareness, and increased confidence in balance during daily activities. Standing exercises train balance in functional positions. Exercise 4. Standing hip extension with external rotation for integrated stability. The fourth exercise is standing hip extension with external rotation, integrating posterior and rotational hip control. This advanced functional exercise trains complex movement patterns essential for safe daily activities. Here's how to perform standing hip extension with external rotation safely. Stand sideways near wall or counter. Place left hand on support for balance. Stand on left leg with slight knee bend. Lift right foot slightly off floor. Turn right toes outward into external rotation. Slowly swing right leg backward behind body while maintaining external rotation. Allow upper body to rotate slightly in same direction as leg movement. This creates controlled rotational pattern through hip and spine. Pause briefly at back position. Slowly return leg to starting position. That completes 1 repetition. Perform 8 to 12 repetitions with right leg. Switch sides and repeat 8 to 12 repetitions with left leg. Start with 1 to 2 sets per leg. Progress to 2 to 3 sets as strength and control improve. Essential safety reminders: use continuous hand support for balance. Move slowly, emphasizing control over range. Keep movement small and controlled initially. Maintain external rotation of moving leg throughout. Allow natural torso rotation with movement. Stop if experiencing sharp pain or significant balance loss. Modifications: hold support firmly with both hands if needed. Reduce range significantly, even small movements provide benefits. Practice leg position without movement initially if balance is very challenging. What to realistically expect: this is more advanced exercise appropriate after mastering previous 3 movements. With regular practice 2 to 3 times per week over 10 to 12 weeks, you may notice improved rotational stability and control, enhanced ability to recover from balance challenges, better integrated hip and core strength, and increased confidence during twisting or reaching movements. This exercise trains complex patterns most relevant to fall prevention. Creating progressive hip stability routines: start conservatively and build gradually. Weeks 1 to 4, master side-lying hip abduction in both positions, internal and external rotation. Perform 2 to 3 times weekly. Focus on proper form and controlled movement. Weeks 5 to 8, add standing hip drop and abduction. Continue side-lying variations. May increase sets gradually. Weeks 9 to 12, if appropriate for your balance level, carefully introduce standing hip extension with rotation. Continue all foundational exercises. Not all individuals need to progress to most advanced standing exercises. Continue exercises appropriate for your individual balance and capability, providing benefits. Essential safety considerations: these hip stability exercises support balance but require appropriate caution. Stop any exercise causing sharp pain, significant balance loss requiring support, catch, dizziness or lightheadedness, or joint pain beyond mild muscle fatigue. Consult healthcare provider before beginning if you have recent hip or knee surgery, severe hip arthritis with constant pain, significant balance disorders or frequent falls, or acute injuries. Always use sturdy support for balance during standing exercises. Practice on non-slip surface. Keep exercise area clear of obstacles. Start conservatively and progress gradually. These exercises work best combined with regular walking as tolerated, other strength training as appropriate, proper nutrition supporting muscle health, and adequate rest and recovery. Realistic expectations for hip stability improvement: hip stability improvements occur gradually with consistent practice. Weeks 1 to 4, learning proper form and technique, initial awareness of hip stabilizer muscles, some may notice slightly improved balance. Weeks 4 to 8, exercises feeling more natural, noticeable improvements in hip stability, ability to progress repetitions or difficulty, improved confidence during single-leg activities. Weeks 8 to 12, clear improvements in lateral stability and balance, reduced wobbling during walking for many, better pelvic control during daily movements, enhanced overall balance confidence. The goal is gradual sustainable improvement supporting long-term balance and fall prevention, not rapid dramatic change. Importance of lateral training: most common exercises focus on forward-backward movements, squats, lunges, step-ups, but many falls occur during lateral or rotational movements. These 4 exercises specifically address lateral and rotational stability, often neglected in traditional exercise routines. While exercises like squats effectively strengthen gluteus maximus, they typically underactivate gluteus medius and lateral hip stabilizers. Comprehensive lower body training should include both traditional exercises and targeted lateral stability work for optimal balance and fall prevention. Conclusion: these 4 exercises, side-lying hip abduction, posterior hip abduction, standing hip drop and abduction, and standing hip extension with external rotation, provide progressive targeted training for hip stabilizers crucial for balance and fall prevention. Start with side-lying variations appropriate for all levels. Progress to standing exercises as balance improves. Practice 2 to 3 times per week consistently. Use proper support for safety during standing exercises. Listen to your body and progress gradually. Combined with traditional strength exercises, regular walking, and comprehensive fall prevention strategies, these targeted hip stability exercises can significantly improve lateral balance, enhance walking stability, and support continued independence and safety. Thank you for watching. For specific concerns about appropriate hip stability exercises for your situation, consult with a physical therapist for personalized assessment and guidance. Subscribe for evidence-based information on balance training and fall prevention for older adults, practical guidance prioritizing safety while helping you maintain stability and independence.